Welcome, welcome, welcome. Yes, it is. How is everybody? Good. We are 2 minutes early, but I like to prepare you all for the excitement. I'm going to stress if you can remember to fill out your evaluation forms inside your bags. That is how we pick the topics that you get to hear every year. And as the person that collects that data, I only can collect it if you fill it out. Our next workshop is with Steve Denton, licensed social worker and the Director of Consultation Liaison and Behavioral Health Integration of LVHN. That is a heck of a title. I mean, that's kind of fancy. Ooh. Steve graduated with his Bachelor of Social Work from Westchester University and his Master of Social Work from Virginia Commonwealth University. He is certified Empowered Relief instructor and has been teaching Empowered Relief at LVHN since 2019. Steve is on the Stanford Empowered Relief Workshop faculty. In addition, Steve is a principal investigator at LVHN, where the network is one of the study sites in Stanford's $10 million 5-year PCORI clinical study titled Comparative Effectiveness of Online Cognitive Behavioral Therapy versus an online single-session pain relief skills class for chronic pain. Please welcome Steve Denton. Thank you.
Thanks. Hi, everybody. If I need to speak up, let me know. It's great to be here. I'm going to be talking about a couple different things. Probably, the primary topic is chronic pain. And it's interesting, chronic pain affects 1 in 3 adults. So whether it impacts you, a family member, somebody you work with, a consumer, we all know somebody that deals with chronic pain. And so this class, or this 1-hour presentation, I'm going to talk about what Lehigh Valley offers as far as a 2-hour single session evidence-based class that equips somebody struggling with chronic pain on how to more effectively manage that. But I'm also going to talk a little bit about chronic pain because I think it's something that, but up to about 10 years ago, I thought I understood chronic pain, how to help somebody with chronic pain. And over the last 10 years, especially teaching this class, I've learned a lot more. And because of that, I'm a better therapist to the consumers that I work with. So I'm going to provide a little bit of a background on Empowered Relief. I'll talk a little bit about the components of the class. And in that, we'll cover a little bit about chronic pain and what you need to know about that. And then lastly, at the end, I'll show everybody, how you sign up for it's free. So if you know somebody who's struggling with chronic pain or yourself, they can sign up for the class. We offer it both in person and virtually at Lehigh Valley on a monthly basis. So Empowered Relief was developed in 2013 at Stanford University by Dr. Beth Darnell. If you check people out on YouTube, and she has a lot of good videos out there, she's really gracious with her time and what she's offering to working with patients with chronic pain. So back in 2013, Stanford developed Empowered Relief. They were funded through an NIH 5-year study to look at the effectiveness of Empowered Relief. More recently, they're doing another 5-year study looking at Empowered Relief delivered virtually. Originally, back in 2013, virtual really wasn't much of a thing. And so they looked at Empowered Relief delivered in person. Now they're looking at it delivered virtually. Does it change the outcome? It's currently delivered in Canada, United Kingdom, throughout European countries, across different continents, and throughout the US at multiple healthcare organizations. We've been offering at Lehigh Valley since 2019, no charge to our colleagues, to our patients and colleague family members. And since 2019, we've had over 1,500 people attend an Empowered Relief class. These are some of the large healthcare organizations across the country that currently offer Empowered Relief. There's over 1,100 certified instructors worldwide, delivered in 26 countries and offered in 7 different languages. So a little bit about the research behind it. So the NIH 5-year study that they did, they looked at 263 people struggling with chronic pain. At least half had 2 or more chronic pain conditions. And they really wanted to look at how it helped the person function better. And what they did is they compared Empowered Relief, so you attend for 2 hours, and they compared that against the gold standard chronic pain behavioral treatment, which is CBT. So if you were going to take the gold standard CBT treatment, you would go to 8 2-hour group sessions. And so they compared Empowered Relief to that gold standard. And what they found, it was comparable outcomes as far as reducing pain intensity, how much pain interfered in people's lives, and pain catastrophizing, which is just worrying about it, thinking the worst. And then they had a lot of secondary benefits, self-efficacy, feeling like I can better manage my chronic pain, I can better cope with it. Other things, how much it bothered them. You know, obviously, if you're doing better with chronic pain, you're going to sleep better, your mood's going to be better, you're going to have more energy. They also looked at it, so the original study was looking at 3 months after attending the class. More recently, they put out a new journal article that looked at people 6 months post-treatment. And what they found is they still had lasting results 6 months after completing an Empowered Relief class. So it's interesting. I work at Lehigh Valley Health Network, work with a lot of medical providers. I'm also in the Department of Psychiatry. And a lot of times, a medical provider may be working with somebody with chronic pain. They prescribe medication, they've done some surgical intervention, and at some point, they feel like, well, I've done medically everything I can do, but the person says, I'm still struggling with my chronic pain. And so a medical provider might think, not sure what else I can do. Maybe I can refer to psychiatry. And so we commonly will get referrals in psychiatry for somebody struggling with chronic pain. Now, as a therapist, I've been in this position probably 10 years ago. Somebody sitting in front of me with chronic pain, and I'm thinking, well, chronic pain is a medical issue. Shouldn't you talk to your doctor about that? I could help talk with you about the impact of chronic pain on your life, but how am I going to help you better deal with your chronic pain? So I think a lot of times therapists, we don't really have a lot of training in how to do behavioral interventions with somebody with chronic pain. It's just not part of our training. So it's interesting. This is the definition from the International Association for the Study of Pain. And the definition is both a sensory, so we all know that well. If I have chronic back pain, my back hurts, that's a sensory experience. I have shooting pain down my leg, I have pain in my stomach, I have a migraine. Those are all sensory experience. But the other half of the definition is the emotional experience. And I'm not talking about you're struggling with chronic pain, it's had a huge impact on your life, and you're depressed because of that. I'm not talking about the emotional impact of struggling with chronic pain. What I'm talking about is the emotional experience. And a lot of times, medical providers are focused on the sensory component. So if I'm treating somebody with chronic pain, and I'm just treating the sensory component, and I'm not focusing on the emotional experience part, how can I expect good results? I'm only treating half of the definition of chronic pain. So empowered relief tries to get at the emotional experience, and I'll talk a little bit more about that. So what patients learn in the class is the neuroscience of pain, really how pain is processed in the brain, how we're all born with the motivation to escape pain, but we're not born with the understanding of how to modulate pain and the distress it causes us. Stress, we also talk about in the class the stress and the pain response, which is related to the sympathetic nervous system, which is the fight or flight. Our sympathetic nervous system helps us escape, helps us to do battle. And both the stress and the pain response are the same, and I'll go over that in a bit. And they also play a role in worsening pain. And then in the class, we talk about how best to manage chronic pain. We talk about how using a daily relaxation exercise can activate the parasympathetic nervous system, which is the calming effect in our body. And so I imagine a lot of people here have done yoga, or they listen to a relaxation exercise, and that helps calm our system. And what we found is it can be the antidote to the pain and stress response. Then also in the class, we learn how if you target automatic pain responses, which end up worsening pain, by using some simple pain relief skills, which you can use every day, and I'm going to go over them shortly. So it's interesting, and I never really thought of 10 years ago, if somebody was dealing with chronic pain in their back or their stomach, and they said, well, all pain is processed in the brain. Doesn't matter where it is. You have a migraine, you have stomach problems, you have a back problem, you have shoulder pain. All that pain is processed in the brain. Doesn't matter where it is. So I may have pain in my back, and I think a lot of us think there's something going on in my back, and there is. I have a medical condition which causes me to have lower back pain. But my brain is actively involved in that pain experience, and for good reason. If you think about it, somebody dealing with chronic pain, if you have to run across 4th Street, you're up on 4th Street, you're going to cross, your back's hurting, you're sort of walking gingerly, you get halfway across 4th Street, and this souped-up car comes racing at you. You are going to run as fast as you can and get across the street. And you're going to stop thinking about your back because you're thinking about the moment, and people have probably had that where they're not really realizing, oh, my back is hurting, because you're focused on survival. And so your brain has decided survival trumps pain, and your brain focuses on getting across the street. Now, when you get to the other side and you're safe, the back pain comes back. So your brain was actively involved in that experience. Now, it's interesting. 90% of people that have an amputation will experience chronic pain. Now, people would say, how's that possible? They're experiencing chronic pain in a limb that was amputated. They no longer have that limb, but they're experiencing chronic pain. How is that possible? Well, they still have their brain. And as long as you have your brain, which is part of processing pain, you could still experience pain despite having that limb no longer there. Now, fortunately, most people in this situation will not go on to develop long-term chronic pain, but some people will. Some people will continue to have chronic pain in a limb, their leg that was amputated, that's no longer there. And that's because they still have their brain. Their brain and their body is still wired towards the chronic pain. So this just highlights the fact that we're all born with the motivation to escape pain. You touch a hot stove, you yank your hand away. You step on a piece of glass, you pull your foot away. You suddenly fall and break your leg, and you're focused on your leg, and I need to get help. We're born with the motivation to escape pain. If we weren't, we'd be in big trouble. But we're not born with the ability to modulate chronic pain, and it has to be learned. The good thing is it can be learned, people can learn how to manage chronic pain more effectively. Pain and the stress response. This is the response that somebody will experience when they're experiencing pain or stress. And I imagine people, it's interesting, I think sometimes when we experience stress, we're not actively thinking about our muscles. Are they tightening? We're not really thinking about our breath, but we're probably taking shorter breaths. Our heart rate increases. We're probably not thinking about our blood vessels constricting. All this is happening when you experience stress and when you experience pain. And it makes sense, because the stress response is really that escaping danger. A wild dog comes chasing after you, you're going to have the stress response, and that will help keep you safe. You step on a piece of glass, and you have the pain response, and that helps keep you safe. Now, one of the things we talk about in the class is all the biochemical when somebody experiences stress and pain. There's cortisol, fight or flight, adrenaline to get you going, and inflammatory markers. It's interesting, people ask, why would I be having inflammatory markers or inflammation as the stress response or the pain response? Well, inflammation fights off injury. So if I step on a piece of glass, I want inflammatory markers going through my bloodstream because that's going to help fight off infection. If a wild dog is chasing me and I'm fearful for my life, I'm going to want inflammatory markers coursing through my body because if that dog rips up my leg, it's going to help fight off injury. But we know that chronic inflammation worsens pain. So if I'm going around constantly having a pain response, then I'm having chronic inflammation, which is worsening my chronic pain. Now, really, this class that we teach at Lehigh Valley doesn't cure people's chronic pain. I wish it did. But it helps people get back to doing things that they enjoy doing, living better, able to do more activities, feeling more hopeful. If you think about the class that we teach at Lehigh Valley and the skills we're going to talk about, it's really giving somebody a little fire extinguisher that they can use in response to their dealing with their chronic pain. Like I said, it's not going to cure it. People have a chronic medical condition which has a pain component to that. And a lot of people, they're going to deal with that for the rest of their life. But the skills that we provide in the class and the education, the neuroscience around pain, equips people with a little fire extinguisher. And so when somebody's in a full pain episode, if you think of a raging fire, that's somebody in a severe pain episode. And our goal is to get that to be a small, smoldering fire, something that's there, something that maybe still has an impact on the person, but the person's doing better and it's bothering them less. One of the things that we'll do in the class, so probably like the first 45 minutes of the class is a lot of the neuroscience of pain. And we talk about the pain response and the stress response. We do a couple exercises to help people get more tuned in to their current stress level and their current pain level. But then what we do is we walk people through a relaxation exercise in the class. It's about 5 minutes long. It's a guided relaxation exercise. And the idea is for people to realize that doing that exercise actually reduces their stress and reduces their pain response. And so we have people that will go through that exercise, and some people have never done it before. It's not something that they've tried before. Other people have tried that and actually used that. And so we go through this experience in the class, and then people realize, wow, this was actually helpful. Maybe my back is a little less tense. I feel a little bit more relaxed. So that experience causes somebody to be more motivated to give that a try. Now, what we do at the end of the class, we give everybody access to a 20-minute relaxation exercise that they download on an app, and they can download it on their phone. And what they're encouraged to do is to use that relaxation exercise on a daily basis. And so they're readily equipped with that relaxation exercise because they have it on their phone. Didn't cost anything. We show them how to download it at the end of the class. Now, there's an interesting thing that's actually embedded in the relaxation exercise. It's called binaural technology. Binaural technology is a subtle sound that's embedded in the relaxation exercise. And the subtle sound alternates between your right and left ear. Now, somebody has to have earbuds on or headphones to get the benefit of that. And so binaural technology has been around for many years. They use it in education. What they found is that it helps in code learning. So if you're learning something new in education, using binaural technology to really speed up the learning of that information. But what they also found is that binaural technology helps to calm the system. And there's actually some study that they did. And so this study, they had 3 groups that were getting surgery. And so when you get surgery, you get anesthesia. And so one group, they gave headphones and they listened to binaural beats, right and left ear, during the surgery when they were under anesthesia. Then they had another group that was listening to classical music on the headphones, relaxing classical music. And then the third group just got headphones, but they weren't hearing anything. Now, everybody was under anesthesia, so they weren't aware of what they were consciously aware of that. Now, we know about anesthesiologists. What do? So they're giving you anesthesia to slow you down, to slow down your breathing. And when they give you the anesthesia, they don't give you the anesthesia and then go into the other room and get a cup of coffee and a donut. They're actually sitting there monitoring your breathing. And so what they found was that the group that was using the binaural technology needed less anesthesia than the other 2 groups. Now, why is that? Well, because they were doing the binaural technology, their breathing was slower. So they didn't need as much anesthesia. So there's a lot of evidence around binaural technology. And so the relaxation exercise that we share out at the end of the class, there's a male voice, there's a female voice, there's an Australian male voice, an Australian female voice. I guess the people from Australia didn't like American accents, so they recorded the Australian version. They're also putting those relaxation exercises in other languages. And so there's binaural technology embedded behind the relaxation exercise. So now I'm going to show you this. This, in the class, everybody who attends the class will put together their own personalized plan that works for them. And so this is what the plan looks like. I will come back to it once I go through a couple other sections. But each person is given this plan and asked to fill it out. And so there is the one section, which is how often I will use the binaural relaxation audio file that I now have on my phone, so it's readily available. And then there's 2 other skills that we go over in the class, and they fill those out as well. And I'll go over those shortly. But I just wanted to give you sort of a preview on what this individualized plan looks like. So before I go on, any questions at this point? Nope? Okay. So in the beginning of the class, we hand out this scale. It's called a pain catastrophizing scale. In catastrophizing, some people don't like the terminology or the the word meaning it's something negative about it, but catastrophizing is really thinking the worst. I'm worrying about something, and I'm worried about the worst that's going to happen. And so the pain catastrophizing scale has been around for about 20 or 30 years. We administer this in the beginning of the class, and we ask people to think about when you're in a really bad pain episode, when your back is really bothering you, when you're in that difficult place, and then to fill out the survey and to answer where you would fall on that when you're in that pain episode. Now, these aren't all the thoughts that you could be having when you're struggling with a pain episode, but there's a total of 13. Some people will have some of them. Some people won't have some of them. Some people will have 1 out of 4. Some people will have 1 out of 3. So people go through and they fill it out, and then they total up their score. So they sort of have a baseline of where they are when they're struggling with a severe chronic pain episode. And then we use this feedback later in the class. Now, the pain catastrophizing scale is really about mindset, and we talk about why mindset matters for pain relief. Mindset also matters for our own emotional well-being. I'm sure a lot of people here are familiar with CBT, cognitive behavioral therapy, or have heard the saying, glass is half empty versus the glass is half full. It's all the same thing. It's all about how we think about things and how that impacts ourselves and whatever's in front of us. And what the research has shown is that persistent pain response and persistent pattern of negative thoughts and emotions worsen pain. So negative pain mindset. Now, recently, Stanford started calling it the unhelpful pain mindset. And I really like that better because negative mindset is a little bit judgmental. So to me, if I'm worrying about something, I'm worrying about my back or I'm worried about a stressor in my life, that may be a helpful mindset because it may cause me to go to my doctor. It may cause me to make changes at work. It may cause me to exercise more as a coping mechanism. So those thoughts are actually helpful. But other thoughts, if I'm constantly worrying over and over and over about my back, and if there's something seriously wrong with it and I'm not doing anything about it, it starts to be unhelpful. And so what we found is that negative pain mindset or unhelpful pain mindset predicts outcome for pain and medical treatment. And there's actually research that has shown that the higher that you score on the pain catastrophizing scale, the worse your outcomes are with medical treatments. So they looked at people and they looked at their score and they looked at how they responded to medication, how they responded to surgical interventions, other procedures. So this is how you can sign up for an Empowered Relief class. It's actually as simple as going to Google, type in LVHN in Empowered Relief. You'll come up with that link. Click on that link, and it'll take us to a web page. You sign up for the class, and then we'll reach out to you with information about attending the class. No charge, don't need a referral, pretty simple to sign up. We're teaching a class tomorrow night, so if you want to attend tomorrow night, sign up on your phone today. Now, we have a couple success stories for people that have attended Empowered Relief. One of the people that attended our very first class, she wrote a blog about her experience. And I remember Linda, when she was in the first class, struggled with fibromyalgia. It was so severe that she couldn't work. She was on disability, had to drop out of school at DeSales. She took the class, And she realized it actually made a difference. She was still dealing with her fibromyalgia, but it was more manageable. So she went back to school and got her bachelor's degree from DeSales, ended up becoming a certified instructor to teach empowered relief, and she's currently working full-time as a hospice spiritual counselor. She was actually featured, Stanford did a piece about empowered relief and people dealing with chronic pain, and Linda was featured in that PBS series about her experience. So if you want to learn a little bit more about Linda's experience, you go to the website to sign up for empowered relief class, and you can read about Linda's experience. There was another woman who attended more recently, and what she found was after the class, she was really struggling, wasn't able to get her grandkids on the bus, really wasn't able to be involved in their lives the way she wanted to. She was looking to get more surgery done, and she attended Empowered Relief. And now it didn't cure her chronic pain. She's still dealing with that. She didn't need to get the surgery. She was able to start doing more, be more involved in her grandkids' lives. And so she was featured in a WebMD article about her experience and her work with her provider at Lehigh Valley Health Network. So the takeaways that I hope you come away with today is that how you think about and how you talk about chronic pain is modified to look at the full definition of chronic pain. So we're looking at it both, if I have, a back issue, I have a chronic medical issue with my back, so there's a sensory component, but also how I think, how I feel about my pain. Do I feel hopeful? Do I feel I can get through this? All of that will influence the severity of my pain, the frequency of my flare-ups, how severe flare-ups are. And so really we need to be treating the full definition of chronic pain. And I think in the United States, we're really good at treating the medical part of pain. We have a lot of surgical interventions. We have a lot of medical techniques that can be used. There's good medications. But we're not really good at the emotional experience, which isn't to say it's all in somebody's head. And sometimes people take that away. They think, oh, there's an emotional experience. You're saying that I'm the cause of my chronic pain. That's not what I'm saying at all. What I'm saying is people with chronic pain have an underlying medical condition which has a chronic pain component to it. And unknowingly to them, because we don't do a good job of talking to people about how our brain is intimately involved in the pain experience. And so if somebody is struggling with chronic pain, they don't think it's going to get better, it's having a huge impact on their life, they're getting caught up in the pain response. And the pain response can actually unknowingly make their pain experience worse. Not something that they're deliberately doing. Nobody's deliberately saying, I'm going to make my pain worse. It's just that most of us have never been taught about the neuroscience of pain. And so when somebody's equipped with that, they're going to get better outcomes. Their medication's going to be more effective. Their surgical intervention's going to be more effective. And they're going to be doing better. Now, Lehigh Valley is one of few healthcare organizations across the country that offers empowered relief free of charge to all of our patients, primary care, specialty providers. Because what we feel is that everybody needs to be provided with this education. And so the last thing I would say, if you know of somebody with chronic pain or yourself, if you have 2 hours of your time to sit at home in your recliner and participate in a class that's not going to charge you anything, and it has the possibility of helping you more effectively manage chronic pain or help a family member, what do you have to lose other than 2 hours of your time? And you could be like Linda, who it really changed her life in a significant way. We get a lot of older folks who attend. Now, I'm in my 60s now, so I guess technically I'm older, who attend. But I had one woman, 90 years old attending the class. So if you have somebody who's not good with technology, they can come to a class in person, or you can participate with them in the class. All they need is some smart device. Could be on their phone, could be on a computer, but really get out the word. I know at the LVHN table out there, we have brochures that you can take with you, but you can also go to the website and sign up yourself. So I have 15 more minutes. Questions for me? Go ahead.
Yeah, where is the Empower Relief class held at LVHN?
When it's in person?
Yeah,
So when it's in person, we typically would either be at Cedar Crest at the main hospital or it'd be at Muhlenberg at the main hospital.
okay, where is it being held this week, do you know?
It's virtual. So basically, if you go to the website and you just need to put in your name, your address, your phone number, your email address, and then we typically have the class from 6 to 8 in the evening, and so it's on Zoom. So you log on at your computer, you listen to the class, they send you all the information that you need for the class, and you just participate it from the comfort of your home.
You can't do it in person?
So we offer it on a quarterly basis in person. So I think our next one is in January in person. Most people tend to do the virtual. It's just more convenient. We don't get as many people in person, which is why we don't offer it every month. In person, we offer it every 3 months.
Like once you sign up, then will they send you a link?
Right. So once you sign up, they'll say, we got your registration. And then as you get closer to the class, they'll send you an email with all the material, directions to where to go if it's in person, or if you're doing it through Zoom, there'll be a link to click on for the Zoom class. Sure.
Why don't they have the locations, or why isn't it informed that 17th and 2, where they had the Lehigh County Mental Health Clinic in there? Because they just changed their programs. You can't get long-term counseling more. You're like limited with the therapist 6 weeks, and there's a huge wait list. I had a therapist for many years, and they discharged me because she kept trying to push on me DBT.
Mm-hmm.
Because they had a class there, and then they kept delaying the class.
Right.
And I told her, no, I've done CBT in college, and I said, that's the one I know about. And nobody said this, because I have a lot of pain, and there's no link that they have, like, a wall where they put group here for this group and that group, but there should be something there where the psychiatrist there should inform that patients there, because, we go to
Right.
other, there's chiropractors in there, there's my PCP there, so I say, why is this component not advertised over there?
I mean, I know the director over there, Irma Moore, and so I can talk to her about that. I send it out to every practice. I go around the network and promote it. I think sometimes people are so busy and so inundated with so much information that it gets sort of lost. And I think sometimes if you're going for counseling, and I know I've probably been guilty of this 10 years ago, I think we almost look past the chronic pain. Somebody, I'm counseling them for depression or anxiety, and I don't actually ask them, what are the other things you deal with? Do you deal with chronic pain? And so I think a lot of times it gets overlooked.
They have therapists with the Valley Health Partners there too. They have therapists and social workers in the Center for Medicine. They have, when they cut me off, like, I still have psychiatry.
Right.
But they didn't have any room there, so I went to Valley Health Partners. I have a therapist there.
Right.
17th and 2, they're wonderful.
Well, good.
So I think, like, if you heard something, I like to just give it to all to them, and not just the head of, like you said, the director there, but what about the psychiatrist, Dr. Martin, and then there's Dr. Burma, and there's like other.
Right.
The psychiatrist, the head
Right. So, yeah, I mean, I've shared it out with all of them, but, I'll give them that feedback because that's helpful to know that they're not hearing about it at 17th Street. And it's really easy. At Lehigh Valley, we have it as part of our electronic medical record. So when they do your after visit summary, they could include that in there. It's really easy.
Yeah, last year I asked to be in an anxiety class in the 17th and 2, and they never signed me up. But this year I was at Muhlenberg and then I was at Transitions, and they finally, the program coordinator at 17th and 2, Bridget,
Uh-huh.
finally signed me up for the anxiety class.
Well, good, good.
I start an 8-week class on Thursday, which I'm anxious to do.
Right. Well, good.
And I did meet Irma.
Okay, yeah. How about other questions?
How about medical marijuana?
I mean, empowered relief doesn't weigh in on opioids or medical marijuana. I think, medical marijuana, like opioids, like other interventions that people do, if it's helpful to somebody and there's no significant downside to them, I think with any, medical intervention, that could be helpful. I mean, the nice thing is somebody could be using medical marijuana to deal with their chronic pain. Somebody could not. Somebody could be having, an opioid prescribed for them. We don't pass judgment on, any of that. Really, you're working with your medical provider to address somebody's chronic pain. What we're offering is something that can be added to what somebody's already doing. So I think if somebody's on medical marijuana and they want to attend the class, I think they would find that it would be helpful.
What if I'm working with somebody that's not a current patient of Lehigh Valley? Because I see it's patients, colleagues, family members. Are they eligible to come there?
Yeah, I mean, typically, the only people that we exclude, and this happens, it's happening more and more, somebody from Hawaii signs up, or we get 6 people from Washington State, or somebody from Nebraska. But if somebody's in the Lehigh Valley, if somebody gets their care at St. Luke's and they sign up for a class, we're not like, oh, you're from St. Luke's, you can't attend. So anybody who lives in the Lehigh Valley, if they sign up for a class, they're going to be able to attend. Yeah. Any other questions? Yep.
If somebody is in Puerto Rico, can they sign up for this?
They'd have to be receiving their care at Lehigh Valley. Just because typically if somebody's visiting in Puerto Rico, but they've gotten their care here, we're not going to block somebody who's like, well, I'm in Puerto Rico right now, but I've been getting my care at Lehigh Valley. Typically, if somebody is from out of state, we'll just look and see have they received their care at Lehigh Valley. Another question? Yep. We haven't. I mean, I think a couple things. It really depends on the severity of somebody's pain. There's some people that have had chronic pain their entire life. There's some people that have chronic pain every single day. There's some people that have really severe chronic pain. I mean, each person, pain experience is different. What we found is that regardless of where somebody has their pain, regardless of the severity, that attending a class can improve somebody's ability to manage their chronic pain. I don't think they've ever looked at, what about somebody with migraines? How effective is it? And like with a lot of things, I have yet to find somebody who said, okay, I'm doing the relaxation exercise, and we encourage people to do it for 3 months to really start to rewire your body. I've yet to have somebody who's done it daily for 3 months, is aware of unhelpful pain thoughts and is actively reframing them, and then doing their self-soothing actions. I've yet to find anybody who said, I did all that for 3 months and I had no improvement. I think what we find is that when people do that, now, it's not going to cure their pain. Now, maybe somebody's daily pain is at an 8, and maybe by doing this, they're more at a 7 or a 6. And it's not curing it, but it's making it less, and by it being less, they're able to do more. And it's interesting, as a therapist, I didn't really think about what I could do with somebody who struggled with chronic pain. But now that I teach the class, I use a lot of this in my work with somebody with chronic pain, really doing some psychoeducation around neuroscience of pain to really help people understand how their pain experience can be changed and how they respond to it, the value of relaxation exercise, the value of CBT, and the value of doing sort of what we all call them coping mechanisms, things that we do to help care for ourselves. And it really makes a difference when you can provide that for somebody that you're providing support for. So, any other questions? Nope? Okay. Thanks, everybody.